Try not to get in my feet.
Come in.
Hi, good morning. How are you?
I'm okay.
Good. Considering, right? You're in the
Yes.
hospital. All right. And what is your name? I'm sorry.
Sherry Oglesby.
Sherry Oglesby. Sherry, I'm Isabel. I'm going to be your nurse today. Can I also verify your date of birth, Sherry?
Yes, it's 9/25/69.
Okay, I'm just checking your bracelet. It matches very well. All right. And how may I refer to you?
Just Sherry.
Sherry's okay? All right. Well, Sherry, I'm going to go wash my hands and gather some things that I need. I'm going to be checking your vitals and then doing a head-to-toe assessment, okay? So I'll be right back, okay?
Okay.
All right. Open the curtain, close it behind me, wash my hands, which I've done in a previous video. Gather what I need, which is my thermometer at this point. Okay. All right, Sherry, I'm back.
Okay.
That was
hi.
quick, huh?
Yes.
All right, Sherry. So we're going to start with your vitals, which I'm sure you've had before.
Okay.
Your blood pressure, your pulse, your respirations, that whole thing, okay?
Okay.
So at this point, I would normally do her blood pressure, which we've already done during the checkoff, as well as her pulse and her oxygen. So I'm just going to go ahead and start with her temperature at this point. Okay, Sherry, so I have a nice little gadget here to check your temperature. So we're going to start with that. Okay. Let me just go ahead and read it one more time. Make sure it's accurate. Okay, and 99. So you're a little warmer than usual, right? But it's still within range, okay?
Okay.
So we're going to go ahead and put that away. And I'm going to go ahead and check your pulse, Sherry, okay? And even though I've already checked her pulse, at this point I would pretend that I'm checking her pulse, but I'm really checking her respirations. Okay, just relax. Okay. Her respirations were 16 breaths per minute, which is within range. All right, Sherry, are you experiencing any kind of pain at this moment?
No.
Okay, so I'm going to go ahead and log in your vitals. Go ahead and put in her blood pressure, her temperature, her respirations, and her pulse, and she's not experiencing any pain right now, and her oxygen levels are okay. All right, and Sherry, are you aware of where you're at?
Yes, I am. I'm at the Rasmussen Clinic.
Okay, do you know what date it is today?
It is October 20th. It is a Monday.
Excellent, very good. So patient is alert times 3. Her speech is appropriate, her vocabulary is appropriate, nothing out of the ordinary has been observed. Okay? All right, Sherry, so we're done with your vitals, so we're going to go ahead and start the assessment, and as we move along, I'm going to try and explain to you what we're doing, okay? If at any point anything is uncomfortable, just go ahead and feel free to tell me, okay?
Okay.
All right, Sherry, so I'm going to go ahead and start with your scalp and your skull and your head, right? So I'm checking for hair distribution and any abnormalities, feeling around. Everything feels nice and within range as is expected. Okay, I'm going to go ahead and check your ears. And I'm just taking a peek with my pen light. No discharge, no irritation. Nice and clear. Any problems with your hearing lately?
No.
Any pain in your ears?
No.
Okay. I'm going to go ahead and whisper a word on each side of your ears, and just if you hear it, I want you to repeat it, okay?
Okay.
Okay.
Rainbow. Flowers.
Excellent. Very good. Okay, Sherry, so now I'm going to go ahead and move on down to your eyes. I'm going to shine my light in your eyes. Hope it's not too bothersome, okay? Okay, and I'm just observing your pupils. Very nice. Now I want you to follow my pen, okay, without getting too dizzy. Very good. Excellent. At this point, I would document Perla for her eyes. Her pupils are equal, round, and reactive to light and accommodation. Okay, I don't see any discharge or redness in your eyes. Any problems recently with your eyes?
No.
Okay, good. I'm going to to go ahead and ask you to tilt your head back gently so I can see your nose. And I'm looking in her nares, which both appear to be patent. Okay, and go ahead and cover one side of your nose. Take a little breath. Same thing on the other side. Okay, a little bit of stuffiness, maybe allergies. Yeah. Okay, but still within range. Okay, let's go ahead and do the same with your mouth. You can open up wide for me. And sticking out your tongue, say ah. Very nice. Membranes appear intact, nice and moist. Lift your tongue up. Okay, and everything appears to be within range. Okay. Sherry, I'm going to go ahead and feel for your carotid artery. Okay, so I'm just going to kind of put a little bit of pressure on each side, one at a time. Nice and strong pulse. Okay, and I feel it on both sides. Very good. Okay, since you're still sitting, I'm going to go ahead and have you move your head around just to see your range of motion in your neck. Okay? Very slowly so you don't get dizzy. I want you to look one way. Either one is fine. Gently, and now turn to the other side. Tilt your head back. Chin down. You feeling okay? Okay, any pain or discomfort?
No.
Great. Okay. All right, Sherry, so now I'm going to go ahead and ask you to step down from the bed if you don't mind. Take your time. Okay, and what I'm going to do now is I'm going to listen to your lungs, okay?
Okay.
I'm going to place my stethoscope. I may have to get underneath your shirt if that's okay, right?
Okay.
And as I'm putting my stethoscope in your skin, I want you to just take a nice deep breath.
Okay.
Every time I move it, I might tell you again, just kind of do the same, okay?
Okay.
And then I'm going to hear your back. When I hear your back, I want you to kind of give yourself a hug, okay? So I can hear a little better.
Okay.
All right? Go ahead, deep breath. Okay, again. Again. One more time. I'm going to go underneath your shirt, okay?
Okay.
Deep breath. And again. Very nice. Okay, I'm just going to look at your side. You can raise your arm for me. Deep breath. Again. Okay. Now I'd like for you to give yourself a hug. Okay, just kind of put your arms across so I can hear a little better. Same thing, I'm going to go underneath your shirt, okay?
Okay.
Deep breath. Again. Okay, I'm going to go underneath your shirt the other way.
Okay.
Sorry about the cold hands.
That's okay.
Okay, deep breath. One more time. One more. And again. Okay, I'm just going to hear the other side. Raise your hand for me, Sherry. Deep breath. And again. Excellent. Okay. Your lungs sound pretty clear. I know you have a little stuffiness in your nose, but your lungs sound good. Okay? All right, as I'm observing your thorax, Sherry, I'm going to ask you to bend down slightly as if you were touching your toes. Don't do anything that'll hurt you, just a little slightly so I can see your spine, okay? And I'm just checking for the curvature of her spine, which looks nice and symmetrical. No abnormalities. Thank you, Sherry. You may stand up. You're not dizzy, are you?
No.
Take a second. Okay. All right. As I'm observing, I can also see that her ratio of her AP to lateral proportion is 1 to 2. I'm going to go ahead and ask you to make some moves to see your range of motion, okay? So before we do anything else, I know I had you moving around a bit. I'm going to check your balance, okay? So I'm having my arms right after you. I want you to close your eyes and just for a few seconds, okay? And I would just wait a few seconds to see if she's swaying within normal range, which she is. All right, Sherry, you can open your eyes. Okay, you all right? Okay. Go ahead and raise your arms to your sides. I'm going to apply some pressure. I want you to resist me, okay? Very good. Now the opposite way. Excellent. Now if you can just go ahead and make some circles. raise your arms as high as you can, wiggling your fingers, rotating your wrist. Very nice. Go ahead and put one of your arms behind your back. Now the other one. Now put your arms behind your back as much as you can. It's kind of an awkward one. Very good. Can you shrug your shoulders for me? Okay. Can you put your hands in front of you this way? And again, I'm going to try to pull. You resist me, okay? Very nice. Now push against me. Pretty strong there, Sherry. Good job. Okay, very nice. All right. What I'd like for you to do now is just go ahead and lift one leg. Okay. Now about the other one. Very good. Oh, don't lose your balance there. Very good. Sherry, I'm going to ask you to walk towards the door, maybe 4 or 5 steps.
Okay.
And then just turn right around and walk back, okay?
Okay.
And our nice pretend door right there. Very nice. Okay. Excellent. Any problems with that?
No.
Okay, patient has good gait, proper posture, no problems observed. Very nice. Okay. So I'm going to have you hop on right back onto the bed.
Okay.
Before we do that, let me just check your pulses real quick because we're looking for symmetry all over your body, okay? I know earlier I checked your pulse and your radial, or your radial pulse I should say. Nice and strong. Just double checking. Very nice. Your brachial. Very nice and strong. And regular, +2 and equally bilateral. Very nice. Okay, Sherry, go ahead and hop on back to the bed if you would, please. Typically we have a lower bed, but okay. So in order to continue with the rest of the assessment, Sherry, I'm going to ask you to get comfortable and lay down. So I'm going to be looking at your belly, okay?
Okay.
All right. Okay, so moving down to the rest of your body, I'm also checking and feeling with the back of my hand for the temperature of your skin. I'm checking the turgor of your skin, which is within what's expected. Nice and smooth, properly moistened. Okay. Very nice. If you could just stretch out your legs a bit. And I'm just checking all her extremities for any kind of edema. Do you have any kind of pain or tenderness?
No.
Any swelling? Any problems recently?
No.
Good. And as I'm doing this, I'm checking her pulse, her dorsalis pedis. And I'm checking on both sides. And I'm also checking for her capillary refill, which she doesn't have any polish, so I'm able to do. I'm checking for her posterior tibial pulse on both feet. I checked the capillary refill in her toe, so now I'm checking it in her hands as well. And as I'm doing the assessment, I can observe too that, as stated before, her speech is appropriate, her behavior is adequate, nothing abnormal. Okay, so I'm going to now take a peek at your belly, Sherry. Is that okay?
Okay.
Let me know if at any point anything feels uncomfortable, okay? I'm just going to loosen up your pants.
Okay.
Okay? And as I'm doing this, I'm inspecting first, looking at her stomach or her belly, abdomen. And then after inspecting, I'm going to go ahead and listen at the 4 quadrants. I'm going to start with the lower right quadrant and listen for abdominal sounds. Okay, and I'm going to move along to the other quadrants. Lower left quadrant, upper, okay, it sounds like there's a lot of activity there, which is good. All right, Sherry, so now that I've inspected and I've heard it, I'm going to go ahead and palpate, and that means I'm just going to kind of touch and press along around in your belly, okay? If it hurts or anything, let me know, okay?
Okay.
And I'm just feeling for any masses. Sherry, have you had a bowel movement?
Yes.
When was the last time?
This morning.
Okay, anything out of the ordinary?
No.
Is it pretty usual for you?
Yes.
How about urine?
Yes.
You've been going
Several
too?
times.
Good. Any problems with that?
No
Any
problems,
pain?
no pain.
Blood? Okay. All right, well your belly looks and sounds good. Okay, and we've checked your extremities, and I've checked your skin and your pulses. Do you have any questions so far?
No.
No? Okay. Well, Well, Sherry, I'm going to go ahead and document my findings.
Okay.
Wash my hands, put all my stuff away. I'm going to leave you the call light.
Okay.
I'll come and
thank you.
check on you within the hour, but if you need anything before that, make sure to let me know or let the tech know, okay?
Okay.
All right, Sherry, thank you. Would you like to stay in bed like this, or do you want me to help you sit
I'll
up?
just stay like this and take a nap.
Okay, sounds good, Sherry. I'll be right back to see you.
Okay, thank you.
I would go and put all my things away, wash my hands, document my findings, and that would complete my assessment.